Hello, welcome. How is everyone today? I see many people nodding, so let's get started. My name is Sabine Kampe. I'm the Managing Director of Open Consultants and your moderator today. I'm very happy that I can see many of our guests here actually on stage with me, and then so many joining via Zoom from across the world. Welcome, everyone. The need to act now. Transformational partnerships for global pandemic preparedness and response. This is our topic today, and I'm delighted to introduce you to my guests. I start with the host of our session, Dr. Paul Stoffels, who is Vice Chairman of the Executive Committee and Chief Scientific Officer of Johnson & Johnson. Welcome, Paul.
Thank you.
Let me also welcome Professor Dr. Ava Marie Coll-Seck, Minister of State to the President of the Republic of Senegal. Welcome. I'm also delighted to welcome Dr. Soumya Swaminathan, who is the Chief Scientist of the World Health Organization. Welcome. And last but not least, please join me in welcoming Dr. Gitinji Gitahi, who is Global CEO and Director General of Amref Health Africa, joining from Nairobi. Hello. We are also expecting Stephanie Saidou, Global Health Ambassador of France, who will be joining a little later. So how will it work? We will first have a discussion here with our panelists, and then I'm going to invite you, the audience here in Berlin, but also those joining over Zoom to ask questions. And for those joining via Zoom, please use the Q&A throughout. Let me start by inviting us to reflect a little bit on the lessons learned from the response to the pandemic. And I'm going to start with our host. Paul, you've spearheaded Johnson & Johnson response to the pandemic. What surprised you most along the way?
Well, what surprised me most is that today we have a vaccine. It was not by design, it was by coincidence that the science came together to get to a vaccine. And I don't say that lightly. It was because of the Ebola epidemic in 2014-15 that the world started to become aware that a pandemic could be dangerous for the world. Many other people had already thought about that since 9/11 and the bioterror war, the potential for viruses to be used in bioterrorism, that some science was ongoing, but it never had been mainstream. It never had been focused. It never had been that targeted. And it's total by coincidence and chance that today we can sit here, as many as you are vaccinated, and that we could do a vaccine in a 12-month, 30-month time frame. And it was after the Ebola pandemic or epidemic that CEPI was formed between many organizations, including Wellcome, Norway, Gates, the EU Commission, the WHO, and others, and companies, that an initial step towards systematic studying of vaccines was possible, began. And 20 vaccines were selected. And in the founding, the foundational event was at the World Economic Forum, and 20 vaccines were selected, 20 viruses were selected, and a number of platforms. And it's by that initial collaboration that we got going on platforms as well as on some production mechanisms, and we got eventually by chance to a vaccine, not by design. And even more by chance is that the fundamental science on mRNA was not that obvious. It is a lady called Kathleen Chirico, a Romanian scientist who fought for 30 years how to bring mRNA into a formulation, and it happened to end up with a small biotech, BioNTech, that it was generated into a vaccine. So the conclusion for me is that we can't depend on by chance luck. We would have had hundreds of thousands of deaths, if not millions of deaths, if we not by chance had come to these vaccines. And that's for me the biggest surprise, the fact that we had a vaccine, the fact that we were be able to, with the international community, to develop them in 12, 13 months. And then now that they are available, not yet worldwide, not yet good enough available in the world, we'll discuss that here, but that the fact that we have a vaccine was by chance. And that should not happen anymore in the future.
Thank you. Thank you very much. Minister Kosek, how is the situation in Senegal? What is your most important learning from the pandemic response so far?
Thank you. I would like, first of all, to say that what we have seen in the world, because we are speaking of pandemic, is the same almost in all the countries. All has been impacted by the COVID-19. Africa at the beginning was not really impacted, but after we saw that it was really there also a problem, and particularly with the weak health system, people were very worried. At the end of the day, we can say that we have been exposed and we have tried to do things, and also we didn't have the big problem everybody was expecting on health. But the problem is more now in the impact, socio-economic impact. I would like to share with you few lessons we have learned from this pandemic in Africa in general, but I will take the example of Senegal. First of all, what we have learned that we need really a leadership, very strong leadership at political level, at the highest level possible, but also leadership at community level with religious leaders, with traditional leaders, but also women and young children, young people, really organization. So this is very important. I can come back if you have some response, but what I can say is that in Senegal, President Macky Sall tried to go over all the distinctions we have in the country, and he called all the parties, everybody, from political to civil society, private sector, to work together and create an important fund to fight COVID. Another point is we need to respond immediately. When you heard that something is happening in China, now people will not say it is there, because we know that pandemic can be everywhere. And it is important to start very early to prepare it ourselves, but also the response need to be immediate. But also we need to coordinate the work. This is really a lesson we learned too. A multisectoral approach, because it's not a health problem and to the Ministry of Health. It's a problem, every sector has been impacted. And it is why we need to promote really multisectoral approach with public, private sector also, and civil society. But it is also important to ensure that everything is well coordinated, and it is what we had in Senegal, a committee where everybody worked, and at the end of the day, it was an integrated reflection, but also approach. Community approach, community-based approach is something also important. I can develop it a lot. Give one example, the one of what we call in Senegal, Bajenu Gox. Bajenu Gox, they are women chosen by the community, by compound. And they were more focused on women and children, but with COVID, we saw their capacity of also speak with the family of everything. And it was also a way to work. Health system strengthening, without a strong health system, we cannot fight any pandemic or epidemic. And this is also something, and in all the sector of the health system. Communication, to say the truth, and not to hide anything to your population. This is also something important. Lastly, and finally, just because of the timing, I would like also to say we have learned that we need to think globally, and it is why we need to strengthen and reinforce the WHO, because if you want something very comprehensive and you don't have money for the institution who is taking care, or give them freedom to do what they want to do. This is something important, but also solidarity. We have seen it. We are, my predecessor was speaking on vaccine, and you have seen the gap between the North and the South. And this is something we need to avoid. It's not fair, and we cannot continue like this. The world is a global village, and no country can alone be safe. We need to remember that every time. Thank you.
Right, thank you. Thank you very much. Gitinji, I'd like to turn over to you now. I mean, your organization also has supported many African governments in their response to the pandemic. Can you relate to what Minister Kolsek just said, and what are your most important lessons that you draw from your experience?
Yeah, thank you very much. And I'm really honored to be here. And I relate completely to what Minister Kolsek is saying. The first thing I would like to say is that in Africa, as across the world, it was very clear that it was a pandemic of the visible. It is only those who could afford to be tested or are close enough to get tested who are visible in the national statistics. Secondly, it is only those who could afford to go to hospital largely and be admitted or be treated, and therefore they were known they were unwell, and therefore when they died, their deaths were counted. Those who died at home, many of them were not counted and therefore were not visible in the pandemic. And therefore, even as we relate to how the pandemic has actually affected the continent, it is important to remember those statistics. I saw a WHO report recently talking about the fact that 6 out of 7 cases in Africa were undetected. And that's not only in the positive cases, but also in the recorded deaths. So it reminds us the importance of the old conversation of investing in civil registration and vital statistics across the continent. In many countries in Africa, deaths at home are not recorded as Ministry of Health data until later because they are initially police cases. When my father died, and I took him to a hospital because he died at home, about 4 years ago, I was told not to enter the hospital statistics. I was sent to the police, rather. So there is this thing that we need to remember. The next thing we need to really focus on is that in any pandemic, in any health crisis, it is actually a dual pandemic. We have seen that we had a biological pandemic, which is the viral pandemic of sickness and death. But we also have, as Minister Kolsek talked about, a serious socio-political and economic crisis and a pandemic. And this was not paid attention to initially. It was actually an afterthought. We didn't include, for example, communities in the initial task forces. We did not include people living with disabilities in the initial task forces. We did not include women in the initial task forces. And these were coming as afterthoughts. And it's important that from the get-go, that this approach to response to a pandemic is actually multisectoral, including private sector, and also multi-agency. We saw that in many countries, for example, because of the need to implement the public health measures at the local level, security agencies were included in the task forces, but they were included not to engage, but to ensure compliance. But if they were actually engaged right from the beginning, it would have been actually critical to actually see what public health measures should we implement and how should we implement them and what do we need to think about. We never thought, for example, that women needed to deliver and were going to go into labor during a pandemic. And therefore, when we put lockdowns at night and women needed to go to the clinic at night, there was no provision for how a woman was to transition from her house to skilled delivery in a health center when there was a total lockdown and the police were deployed and they were meting out police brutality. That came out as an afterthought. So this is something that we've learned that we need to include and involve very early on. The next thing is obviously the role of the private sector. We saw in some countries, Kenya, Uganda, we established what we're calling the National Business Coalition for COVID-19. These were involving to ensure that commodities were available to communities for hygiene, public measures, but also to provide flexible funds for government locally, because governments are not made for emergency response. The procurement processes of government that are set up in the public financial management systems do not allow government to mobilize resources from its coffers urgently and to mobilize communities. They only allow for long-term procurement of commodities. So private sector came in very, very critical to actually do this response. And of course, as was said earlier, the private sector has been critical in ensuring that we have commodities and tools to end the pandemic fast enough through innovation, research and development, as was said by the Vice President of J&J. So that has been really critical. But there was something I need to mention about the mismatch that we saw between the community needs and the government approaches. There were some studies done, especially for informal sector, that were very clear that what the communities needed immediately was money because they had lost their jobs, was food, and was water to drink. But the major efforts were put into providing soap for hand washing, masks, which were necessary, but they should also have been matched with a clear understanding of what the immediate community needs, because then that would have encouraged more compliance of the measures as they were. So again, a mismatch that should be, should be included very early on in the response, and also make sure that there is data to inform that setup very early. Technology was critical. We saw, like for us ourselves, we employ technology on mobile phone technology to train community health workers in multiple countries in Africa, because they couldn't assemble anymore because of social distancing. So we saw countries like Ethiopia, Uganda, Rwanda, and Kenya adopt our mobile technologies more rapidly than they have done in the past. And therefore, technology was really, really critical. We found that there was no inclusive responsiveness. People, we found, like, for example, people who lived with hearing or visual disabilities were not considered in the risk communication, and therefore they did not know what we were asking for. And in some countries like Malawi, we had actually to go ahead and translate all the materials to Braille so that people who were living with these disabilities could participate in the risk communication and therefore the measures that were needed for them. But as I conclude, most importantly, there was actually that international and regional collaboration was so critical. We struggled with Tanzania initially, and therefore countries that had borders shared with Tanzania could not put full measures of control because there was no collaborative border risk management. And this is a teaching to us as we look forward that international and regional collaboration is a prerequisite to any pandemic treaties that can happen and any measures that we put to bear forward. And finally, trust. That where countries did not have adequate trust of their populations, they struggled. There was civil unrest. And we are seeing it also in the vaccine rollout, that trust is needed, is actually built before it's needed. It's not built when it's needed. Governments struggle to build trust at the critical point. And it is a reminder that we need to build the trust before we need it, before the next pandemic. And that reflects to our social fiber, our economic response to the young people, and also our political dispensations and how we engage communities at every step. So those are the things I would like to say about our learnings, and we continue to respond with governments, but also that government participation, community participation was critical right at the forefront. I would like to submit there.
Thank you very much for now. Thank you so much. Dr. Swaminathan, I'd like to turn to the topic of R&D now. And I think everyone has seen that the pandemic actually has shown that accelerated health product development is possible. So why did it work? And what was WHO's role?
Thank you for that question. And I think the previous speakers have made excellent points, but let me come to the point of the R&D. After the West Africa Ebola outbreak, I think a number of lessons were learned. Paul also mentioned the development of some of the vaccines and therapeutics that started at that time, I think played a role in serving with the COVID pandemic. The member states at that time obviously also looked at the response to that outbreak, to the epidemic in West Africa, what could have been done better and so on, and asked WHO to set up a framework, a partnership for R&D. So it's called the R&D blueprint to prevent epidemics. And essentially what it was is outlining how you would approach product development for a pathogen. And so there was a list of priority pathogens that was developed. And one item on that list was something called the pathogen X, which meant any unknown pathogen that might cause an epidemic or a pandemic in the future. And a research roadmap was developed for each of the pathogens. So Ebola, Nipah, Lassa virus, all of these were on that list. And there was a roadmap created for how you would approach development of diagnostics, vaccines, therapeutics how would they be tested, target product profiles. So that preparatory work that started in 2016 also developed a network, global networks of institutions, of researchers, of academics, of partnerships, working with the private sector as well. I think that really came in very handy because in January, the R&D blueprint was activated. And in February, we had the first meeting to develop a research roadmap for this new pathogen. So on February 11th, which was the day that the virus was also named, we also had this meeting going on in Geneva where we developed a research roadmap, identified all the knowledge gaps. At that time, of course, almost everything was a knowledge gap. There's very little known about the virus, and a roadmap, not just for product development, but also for things like looking at the origin of the virus, the epidemiology, the transmission patterns, how do you do infection prevention and control, as well as very importantly, social and behavioral research. So there were several tracks, and each track had people came together from around the world. So we have hundreds of working groups and expert advisory groups that have essentially worked over the last 21 months round the clock to share information, to share the latest data, but also to discuss the advances as they come along. So now, for example, discussing what are the correlates of protection for vaccines, what is the role of additional doses or booster doses, what about vaccines in children? So looking at therapeutics. So I think this blueprint that was developed after Ebola was very useful. I think we have to strengthen it, build on it even more. And of course, people want to be more ambitious. And there's, you've heard of the 100-day plan that was proposed by the UK to the G7, saying that next time around, we should have these products, including vaccines, within 100 days, even though it was amazing that we had it within a year in this case, because of the platforms that we have today. The second thing that we did was, how do you synthesize evidence and data when there's something that's changing all the time in order to make the best recommendations on public health policies to governments? Because many governments look to WHO for advice. And when you start with a situation of not knowing much about the virus, you work with prior knowledge of respiratory pathogens, and you put forward a set of guidelines which are pragmatic, but then you have to evolve as new data comes in. And so we set up these large networks also for evidence synthesis and rapid reviews. So we have almost 100 institutions working with us, doing rapid reviews of topics like, transmission. There was a huge amount of debate on how this virus transmits, on the wearing of masks, on measures in schools, so many topics. And we were able to then do something called living guidelines, which means that you have the guidelines on a digital platform and you update specific recommendations as new data becomes available. And this has been especially useful for therapeutics, for treatment guidelines, because in the beginning, we were just going by, some anecdotal experience, but then we had these large platform trials that were set up. And again, the WHO set up the Solidarity Platform trial. We had the UK setting up the recovery trial. There are at least 4 or 5 large platform trials around the world, which really are the ones which delivered results, because we had otherwise thousands of trials that ultimately, unfortunately, were just a waste of resources, because small trials with small numbers do not answer the questions you want to answer. So we need for the future also, I think this is a good learning, that we need global collaboration to run these large multi-country, multinational trials, whether it's for vaccines or for drugs, because that's the quickest way of getting evidence. And then, of course, you have to use that evidence, put it into guidelines. And I think something that surprised me was that politics and ideology came into treatment and prevention. Normally, one would think, that healthcare workers go with evidence that's presented, and then you prescribe a drug based on, the recommendations of WHO and other guideline agencies. But in this case, it was all politicized. And so we lost, I think, a lot of resources, time, and probably lost patient lives, because there was no agreement on on what evidence-based guidelines should look like. So I think we have to do better in that sphere. And finally, I would say that we made huge strides in using digital channels for communication. The WHO traditionally communicates with health ministries. They are our counterparts, but we decided, I mean, we saw very early on, there was a huge need for information. So Dr. Tedros actually started these daily press conferences. Every day at 5 o'clock, we'd have the press conference to tell people the latest that we knew. And this continued for several months. And then we went to 3 times a week and then twice a week press conferences. And we used all the technology platforms possible, from Facebook to Twitter to YouTube to Google, for 2 things. One was to bring credible information to people. So Google and Facebook and these other companies agreed that if somebody searches for a keyword related to COVID, that they would make sure that the link went to either WHO or to the CDC or some credible agency, and not to a vaccine misinformation site. And secondly, we use these channels to also identify the misinformation. And again, we coined this term infodemic, and Dr. Tedros, I think right at the beginning in February, used the words, we're fighting a pandemic, but we're also fighting an infodemic. And I think that still today is creating problems in many parts of the world, because people are getting confused by the messaging, conflicting messaging out there, and not understanding what the right behavior should be, at the right time. So I don't think we're over that. We've learned a lot now, and we can apply that to other public health problems as well. So I'll stop there.
Great, thank you. Thank you very much. I'd like also to welcome Stephanie Saidou, who is Ambassador for Global Health of France. Welcome. And we've been discussing in our first round here the lessons learned from the pandemic. And that would also be my first question to you, since you're now joining the panel. What are your most important lessons learned from the pandemic, and how has France reacted?
Thank you very much for the question, and sorry for arriving late. Well, the lessons are that although the crisis was indeed unprecedented, it was certainly not a surprise. And well, the world had enough warning with previous pandemics to rest prepared to some extent. The international health regulation had been passed, and we had the WHO as the watchdog, and countries had their own national preparedness plans. But with all that, we ended up completely unprepared. And when the pandemic struck, we found ourselves yet again in the middle of the usual, panic. And I think that, and all of us at different levels who have been through this, will forever remember it this time round, I hope and I believe. Now, that being said, there was a very rapid response, and in the circumstances of, terrible crisis, a good reflex was put in practice, which was that of cooperation and a multilateral response. That's at least what France's experience was, that there was indeed a collective call which was answered to work together within this Accelerate Access for COVID Tool Accelerator, ACT-A, multilateral response. And from the beginning, and that was definitely a message which France insisted on, a message on equitable access, not only a message, but an objective of equitable access, and of there also needing to have a response respectful of health systems, or taking into account the health system dimension. This was not only about finding and getting the innovative tools, which were indeed needed back in 2020, when we didn't know that the vaccines would be coming so quickly, and that was indeed quite a remarkable feat. But we knew from the beginning that if and when they came, we would need prepared health systems in place in order for them to be effective, efficiently deployed. And this is, I believe, still the phase that we are in many countries. So as lessons learned, I will stop here to say that I really hope that this time we can all really remember this feeling of panic that was felt throughout the world. And luckily, scientists were in place who were able to see through this a little more lucidly and clearly than maybe policymakers, which had to deal with a great unknown, and not let go of that feeling in order to ensure that, and this would be my main point, and certainly the main recommendation that France is trying to follow at the moment, is to elevate due attention to preparedness and to health investments to the right political level, and that it never leave that front piece position on the global political and financial agenda. I don't think the planet can afford to fall back into neglect once again. So this would be, I think, the main lesson learned at this stage in the discussion.
Thank you very much. Let me pick up your point and invite us all to look into the future, right? And discuss a little bit how we can improve pandemic preparedness and response going forward. And I'd like to start with Paul. Platform technologies have played an important role, right, in the response to the pandemic, and a lot of investment went into their development. So now that we look into the future, how can we make sure that innovation is supported, that we can be prepared to new health challenges?
Yeah, I think I'll pick up where Basha said, we all have to go for never again. This is like a world war, yeah? So we have so much damage in the world on health, on people. The number of deaths is like, it's like unprecedented. The economic challenge in the world is unprecedented. We have to approach this in a way that we have to set ourselves up for never again. We are going to go through this. And I hope that this pandemic will learn us that we'll have to make technically, and now I talk technically about vaccines, diagnostics, drugs, we have to be prepared to be at all times ready to fight a pandemic. And that's where, when we went to previous pandemics, whether it was, my team was part of SARS-CoV-1, and we made an antibody so long ago in '95, yeah? And nobody anywhere paid attention to it, that was important. Then we went to Ebola a few times, we went to Zika, and every time after that, as a group of scientists where you were involved, as soon as it left the global press, the global media, it was dead. Yeah, nobody talked about, and let's hope that it never comes again. I think now with Ebola, and Sumia, you were there in 2015, 14-15, Ebola could have been a global pandemic, and that was the warning for getting prepared. Now investment started. I think the first investment with CEPI was 800 million. In the meantime, billions of dollars have been funneled into this to accelerate platforms, yeah? Vaccine platforms, drug discovery platforms, diagnostic platforms, but also clinical trial platforms, regulatory and digital platforms. If you look at what has been established from a system now, or mechanisms to go fast and to go, for example, to a 100-day plan, it only will be possible if these platforms will be maintained and become mainstream important platforms, like oncology is in R&D, like immune disease, like infectious diseases. They have to be mainstream and mainstay into the world community to be able to be prepared. You know? And we learned a lot from HIV. The fact that we were able to do a clinical trial on 3 continents in 3 months, North America, South America, Africa, was because there was still a significant HIV clinical trial network in place, which was studying HIV vaccines. And people were ready, and all other preventive methods were ready to, in full pandemic with no possibility for anybody to travel, you could access that. And at the peak, we were recruiting 3,000 people a day into a vaccine study, while we never had met with the center. But because they were existing, you could do it. And Sumia is mentioning the platform trials now on the solidarity. Those platforms will have to be sustained. And that will require priority in financing, priority in investing, priority in maintaining it, even when this is over. And that is where we have to remember, even when this is over, it has to continue. And I think it's going to be a very challenging situation unless we create like a NATO-like organization to say this is going to be pandemic preparedness and make sure that this never happens again. So I think we learned a lot. We know what to do. Science is extremely advanced. So it is possible. Drugs, diagnostics, vaccines. We have to do it global because the nationalism in the world determined that vaccines stayed in region and it was unequal distribution, non-equitable. Almost we all promised to do it. We were not able to do it because of nationalistic approaches in entire world. And I think that's where all these learnings have to result into what is a global plan going forward. And I think we can get there if we continue as a community to be committed to make it happen.
Great, thank you. Thank you very much. Gitinji, I'd like to ask you now, what should be done to improve pandemic preparedness and response? What are your priorities?
Well, I think it's been headlining, and I think each of the panelists has reflected on this, that we've been caught literally pants down and lost lives, lost livelihoods. And I think the first beginning to prepare for the future is to recognize that global health security is a sum of national health security, which is in turn a sum of the local health security. So as we think global, we must act local. And we have seen the significance of having for example, the Africa Centers for Disease Control in Africa, and the way it's been able to coordinate regional efforts, and also trying to work with country by country so that we can build each country's public health system. As we move forward, we must build public health capacity in countries, in each country. We cannot afford to look at Africa or the rest of the world as a continent and say we have a global preparedness and response agenda. That agenda must be built on building local and national systems. These national systems must be properly capacitated with public health capacity that is adequate to actually have core capacities for international health regulations, implementation and practice at country and at local level. The next thing is that we need the workforce. We need public health workforce. If I look at the continent of Africa, we need, for example, 6,000 epidemiologists. We have only about 1,800. How do we train that so that we are ready for the next pandemic? We don't want to have a handful of epidemiologists who are running to West Africa for Ebola, then they run off to Congo for Ebola, then they run off to, when you have a continental and a global pandemic like we had with COVID-19, that's not going to be feasible. And we need to build those systems right now. The next thing is to say that we need to see that actually disease threats are security threats. Disease threats are security threats. We found that when we embedded, security systems, as I said earlier, there was a more community engagement because the other systems, including community policing, which happens in many other countries, came along to actually manage the pandemic. How do we look into a future where every single security level, local security committees, include community health workers, because disease threats are security threats? How do we make sure that national security committees that are largely made up of defense and others actually include the Ministry of Health, because this is what it should be? And finally, as we consider about in this particular area, as we look at how we are going to create the global security threat or health threat council, what about looking at WHO having a standing committee within the UN Security Council, just like NATO has a standing committee within the WHO, within the UN Security Council? So that is something we need to look at as health threats, as security threats. The next thing is to look at the importance of rebuilding our health systems. UHC has been discussed. We have a UN declaration, but our country is paying enough attention. It is time to accelerate universal health coverage because health is wealth. We've seen that health is actually a shock absorber for the economy. So UHC needs to come strongly on the agenda because without strong, resilient health systems, we are not going to have actually a global or even national health security. The next point I want to talk about is commodity security. You've seen how the injustices have been meted on low-income countries, on vaccines, whereas research and development and science has proven it's possible. We still have countries that have 1% full vaccination. Africa now is approaching 5%. Yet we know in the UK, I was looking at data, that now case fatality rate is 0.3%, whereas in January, it was, about 4% or so. We know that vaccination works, but yet we have not been able to deliver vaccination to low-income countries so that we can reopen economies. The final thing I want to say is that as we look forward, we must build regional and international collaboration. And we must also support regional collaboration. We must support Africa CDC. We must support regional preparedness and response authorities that are going to be created. I know the European Union or Commission is creating HERA. Africa is looking to also create an Africa Preparedness and Response Authority that, of course, has to work with existing structures of WHO and the IHR and the global mechanisms that are being created right now. Let's remember that global success will be dependent on regional success, national success, and local success. Those are the things that I would like to put on the table, but I'm happy to answer any questions that come up in terms of looking into the future of a prepared and responsive world.
Great, thank you very much, thank you. I'd like to turn to Minister Kolsek now and pick up one of the points that Gitinji made. And there's a lot of discussion on local manufacturing in Africa, and Africa is still highly dependent on vaccine imports. So what do you think? How can we strengthen local development and production of health technologies?
Thank you for this question, because this is our problem. And everywhere we are going, we are putting on the table the issue of local. This has been developed already, but now we are speaking on this local production. Just to know that Africa is consuming, we can say, 25% of the volume of vaccine in the world, but manufacturing only 1%. We are buying 90% of our product in general, medication, etc. And we are just maybe producing 10%. No, vaccine, medication, equipment, everything. This is really a problem. We cannot continue to wait for others to do things and to buy it, and we buy it from them. This is something we need also to know. We have scientists, we have engineers, we have people trained. And if you look at Nordic countries, a lot of African are there also, highest level of knowledge. We need to do things in Africa. If I look also at the new initiatives taken by the African Union, like the issue of trade areas, free trade areas in Africa, but also the African Medicine Alliance. This is something we are taking some initiatives to ensure that we will have local production. I want to say that the partnership between the public and the private sector need to be stronger. The transfer of technology too. And today what we have seen in Africa for COVID is that some countries are taking the lead. South Africa, countries from Tunisia or Egypt, etc. in Africa, but also Rwanda and Senegal is not also just sitting and waiting. We are also trying to see how to support and to consolidate what we know already. You know that Africa is manufacturing yellow fever, and we have some experience on vaccine production. And now with public-private partnership and transfer of technology, we are planning, we are about to have this production of vaccine in 2022. And this is what a lot of other countries would like to see for Africa. Not everybody doing the same thing, but at least I like what has been said by regional organization. We need to maybe just focus on one sub-region, one country, another sub, but not everybody doing the same, because we need to sell also this product. So I want to say that local production is very important. Let me add, it's not your question, but because I have not heard that very well, is the issue of innovation. In the way forward, we need really to look at innovation in Africa and particularly young people innovation. During the COVID-19 pandemic, in our countries, we have seen a lot of initiative taken, a lot of innovation. We need to also use this and put Africa in a way and in a level, which is a level needed, but we have the possibility to do that. It's time to do that. Thank you.
Thank you very much. Dr. Swaminathan, I mean, the emergence of new pathogens is definitely one of the biggest global health threats we're facing, and the pandemic has shown that no country was really fully prepared. How can WHO even better support countries to detect and react to new pathogens?
Thank you. And a lot has been said, and I agree with Minister Kolsek and also Gitinji on the actions that need to be taken at the country level, because I think clearly pandemic is something that is global, but the actions have to be at the country level and also at the global level. So at the global level, we have WHO, which is the agency for the coordination and protection of health, and it's the normative agency. It provides all the guidelines and support. What is needed now is to reflect on how can you further strengthen WHO? And I think this is going to happen during, the special World Health Assembly. Member states are going to discuss on a pandemic treaty and what such a pandemic treaty should have, because without that very high level of political engagement and agreement, it will not be possible to change some of the things that actually stood in the way this time. For example, it's been mentioned that WHO really needs the resources, but also the powers to be able to act quickly in an emergency. Health security has been likened to other, well, if you liken it to other kinds of national security, then you also have to act in a way that a biological threat is a threat to everyone, and therefore, whether it's early data sharing, it's informing the world that something is happening, putting people on alert, making sure that investigations can be done at the place where the first reports have come from, because time is of the essence and we cannot afford to lose any time. But also there needs to be, I think, agreement on things like data sharing, the sharing of genome sequences. Luckily, this time we had early sharing of genome sequences, and that was enough to get the vaccine and diagnostics production started. But you do need eventually the virus, also the biological specimen. And in a situation where it's contained in 1 or 2 countries, you need the virus to be able to come out. And once it's a pandemic and everybody has the virus, then it's not an issue. But in many cases, you need the biological sample. So the pandemic treaty must address how that will be done. As you know, the WHO has created the BioHub, which is one step or one way of approaching this, where it's voluntary at the moment, but countries can share their virus samples with the WHO. And right now the hub is in Switzerland, but ideally there should be a network of hubs around the world, just like we have the network of influenza labs around the world. We need for emerging pathogens also. But then comes the issue of benefit sharing as well. So on the one hand, the sharing of knowledge, data, etc., is very important. But then on the other hand, there has to be a global compact on how there's equitable sharing of the products, the health products that are developed. And again, this is something that we haven't been successful at. I think everybody knows the stark differences between vaccine coverage in the high income and the low income countries. There's a 30 times difference now, with Africa approaching 5%, but high income countries, many of them are over 70% coverage. And the same for diagnostics, the same for treatments, monoclonal antibodies, etc. So while science and technology will now definitely be able to provide much more rapid answers in the future, if we continue to invest in those platform technologies, build local manufacturing, have distributed manufacturing, so that at the moment you have the genome sequence, you can get all of those mRNA or viral vectored plants into motion around the world, creating the vaccines. But that alone will be insufficient because of funding, for the procurement and the distribution also needs to be. So there has to be some kind of a global financing and a compact and agreement on, regardless of where the innovation comes from and which company is the first to develop the product, we ensure that it is equitably procured and distributed. I think otherwise we will repeat the same mistakes. And I'm not repeating all the excellent points that have been made already about investing in national systems, in the workforce, in regulatory systems. We did a lot of work with regulators because normally, a new health product goes through one regulator at a time, getting approval. Obviously, in a pandemic, you cannot afford to waste that time. So luckily, regulators around the world agreed that once the product is WHO emergency use listed, it would receive automatic licensure in their country. So many such innovations happened during this pandemic, which we need to make sure that we use that for future responses.
Thank you very much. Thank you. Ambassador Seydoux, France, of course, has a very important year ahead because you will hold the EU presidency next year. So what are your plans for leveraging that to improve pandemic preparedness?
Thank you for this question. Indeed, France will be presiding the European Union as for January. It's in a few weeks and months to come, and we're coming after other presidencies which have already set up quite a number of orientations, including a few months back, the German presidency. And I remember in this forum, it was virtual then, a year ago, we were discussing the new directions for the Europe of health. So it would be very much in the continuity of this awakening, which was pretty much due to the crisis, that Europe indeed needs to, well, move forward in a number of directions. So there are directions which will be promoted and keep being promoted on a more integrated approach, European approach, with a number of agencies to be strengthened, such as the European, the EMA, European Medical Agency, also the European Crisis Center, the ECDC, and the new agency named HERA, which will be started soon to promote research and development at European level. So these are orientations within, let's say, the current European institutions. But a very important aspect will be also a coherent approach to the global health issues and definite direction in European policies to connect properly with the multilateral and global level of attention to be given to health as a dimension which is necessarily global. And within that, also very determined orientation towards, well, let's not call them development, but rather partnership policies and solidarity policies with our partners from abroad. In February, there will be a very important summit, so that France will be preparing as chair of the European Union, between the European Union and the African Union. We've been talking about this in this conversation with our distinguished guests from the African continent. And so there's definitely a very important investment to be made in, indeed, possible project of a African, well, it's not possible, it's underway, but it's not yet completely created, the African Medical Agency, which would be equivalent to the EMA, the European EMA. Capacity production, very important area of cooperation, as you have already said, Minister. And indeed, health system strengthening, which Dr. Gitahi has mentioned, and how could the European Union help promote, well, the progress of all, including Africa in the case of that summit, towards universal health coverage, which, as we all know, since health systems are the best line of defense against future pandemics, if that is the objective. But it is also an objective in and of itself, that of attaining or promoting the attainment of universal health coverage with, as you were saying, Dr. Swaminathan, the right level of financing. And that brings us back to the necessity to have the health priority still very high on everyone's agenda at global multilateral level, as well as national level.
There's one initiative I forgot to mention, if I may, and that's because we are in Berlin. I should have mentioned the new Berlin Hub for Epidemic and Pandemic Surveillance and Preparedness. It's a model based on collaborative intelligence. And the idea really is that you need, we talked about the data sharing that's needed, but it's not just the health data that's needed. You need to bring together many other kinds of data on what's happening in the environment, the migration of animals, but also humans, how they're moving around, what the interaction is between the climate, the changing patterns, where new viruses, are more likely to arise. And so it's based on really having a lot of different kinds of data coming into this hub. Of course, we have to make sure that we have good quality data coming in. That's where the national systems come. But then using analytics, using things like artificial intelligence, like swarm learning, where you can use blockchain technologies now to pick up learnings from different countries without the data ever having left those countries. So there are now federated approaches to data and analytics, which also protect the integrity of the data sets. And then finally, using those analytics to inform the right policy decisions. So the Berlin Hub was just inaugurated 2 months ago here by Chancellor Merkel, and we're looking forward really to a very different approach, a different way of global collaborative intelligence to prepare and to prevent, hopefully, the next pandemic.
Great, thank you. Before we open up to the audience, I would like to ask Paul, in reaction to what we've heard from the panel, what is ultimately needed to improve global pandemic preparedness and response?
I think every of the speakers very complimentary in what is ultimately needed. Yeah, but the first and most important thing is going to be that we not forget that we are in the middle of a current pandemic, and that until the last patient or the last person is protected or cured, there is the chance that a virus with a different variant comes back. This is a very risky situation we are in, that if we don't get the vaccines to everybody and we can eliminate the virus in the world, it's going to be a risk for the future. And as people said, the pandemic has been a health warning for everyone, but it also warns about the health systems who are in fragile state. And I think this is the moment that we have to focus on health and put the world in a much better health situation, and use the learnings from the pandemic to not just put the health back in health state, the world in a better state of health, but at the same time learn for future technologies. How can we work together like we did this time to accelerate the science which is developed in the world for availability and access to people worldwide? We learned so much. The regulatory system worked unbelievable. Yeah, can you imagine that vaccines were approved on a global basis within a month after the clinical trial data were available? It's amazing. And so we learned that we could do this. I think we should learn on how we apply this to future health interventions and make sure they become available much faster and not 10 or 20 years later across the world. So I think big learnings, and let's focus on getting the vaccine, the COVID-19 eliminated, or we are not yet out of the woods.
Great, thank you so much. I would like to invite the audience now. I'm starting here with the Berlin audience. Who has questions? We have microphones in each of the hallways. So please just stand up. Maybe you say your name and your organization, and the floor is yours.
Thank you so much. My name is Professor Velavan from University of Tübingen, born in India, a German professor, working in Asia as well as in Africa from the Pandora network. from the Pan-African Network for Emerging and Re-Emerging Infectious Diseases, as well as the Pan-Asian Coalition for Epidemic and Outbreak Preparedness in Vietnam and the ASEAN countries. I've been following COVID-19 since my first publication, which I read, was on the 14th of January. I agree. The 30th of January, the WHO has made this as a public health of emergency concern, and 11th of February 2019 NCOV became the COVID-19 disease, and the SARS-CoV-2 was classified, and the 11th of March it became a pandemic. This is absolutely, I agree. What is missing was the diagnostic capacities in these countries were completely missing in the early phase of the epidemic. The panic mode was on, but nevertheless, these diagnostic capacities were not in place in many of these African countries. And my question revolves around to this concern, why such a discrepancy has been seen. How best we could have circumvented such a problem, because unless you don't test, you cannot track. And there are many countries in Africa never did their testing. And there were many countries, even in Tanzania, you don't have cases. And there are many African member states even say they don't have COVID-19, including in Asian countries such as Mongolia, or in other countries such as North Korea or elsewhere. And my question is also around now, there is always an outlier here, which is South Africa, which has a tremendous capacities in terms of testing. And this has never been disseminated into the African member states. And this also applies till now, where we see a large number of global sequences being submitted by the member states, but 70 and more than 80% of this variant of concern comes from South Africa, not from the other African member states. Why such things? This is happening now, since also from the diagnostic capacity which was in place, which is a multilateralism failure, or is it a two-track pandemic approach? I would like to leave this question to WHO. Thank you.
Great. Thank you so much. So how to improve diagnostic capacities is the main question. Who would like to react to that question?
I can start. I mean, I think he's identified a very absolutely a problem. It is true that when the virus was discovered, there were only 2 laboratories in Africa that had the capacity to do the diagnostics. But very quickly, WHO, many partners worked with the countries, and today I think every country has the capacity to do molecular diagnostics. The same for genomic surveillance. We started monitoring the viral evolution, way back in May, June of last year, but then there were very few sequences from Africa except from South Africa, but that is also changing. So I think diagnostics traditionally have been neglected in many, many diseases. And I think there is now recognition that without diagnostics, you cannot treat, whether it's an infectious disease or whether it's a non-communicable disease. So as part of primary health care, as part of universal health coverage, we have to give as much importance to diagnostics as we do for treatments or for other health products.
Great, thank you. Anyone else would like to add?
Yeah, I would like to add that this is also one where new technology has to be developed to make it simple and point of care and disseminated. It has been the example now on virology, how it has to be much simpler, be able to diagnose. We were working on an HIV viral load point of care. We were able to quickly turn it around into a point of care for COVID, a PCR test, but it's far too late. It's like you have to anticipate that PCR in a decentralized way in each health center in Africa should be available. And then the samples should be collected to go to the biohub in order to make sure you have the strain. So that it's part of your capacity building on how do you train people, but also technology has to be developed to be able to enable that.
I agree that we need to have also simple technologies. When you look at rapid diagnostic tests, for example, for malaria, it has been now common in Africa where everybody at the community levels and can use it. But if you have too sophisticated technology, this is an issue because all the labs are not well developed. And I would like to come back also by this question to what has been said, looking at data surveillance. Without diagnostic, without test, you cannot say that the data we are just publishing as the one we need. I am very concerned by some countries where you have very, very few COVID, because I am sure that the data collection and the surveillance is not good. The issue of diagnostic is real, and we need to ensure that we are using more and more innovation to be able to have the tests everywhere, the diagnostic tests everywhere, and not only in capitals or big labs.
Great, thank you.
And I'll compliment on 2 points. It's a great question, thank you. No, diagnostics are key, including, you were very right to say that we're still in the middle of the pandemic, so the vaccine is definitely a tool, but the treatment is also, we hope, now also soon to be, well, a possibility, and the question will be that of its accessibility. But in order for the treatment to be, for a right strategy to be deployed with treatments, the tests are necessary, because those treatments which are now promising can only be given in certain conditions which the tests can reveal. So the diagnostics are really a national strategy or health strategy tool to combat COVID. My second point is, there's a great conversation starting on innovation and what is it, and as we all know, innovation without access can actually promote inequalities rather than the contrary. So very important to understand what innovations we're talking about and how they can actually help. And France believes very much in one organization which does exactly that, and which is UNITAID. And we have been through the ACT-A accelerating, which I've been mentioning before, contributing to enhance UNITAID's capacity to come up with the right kind of diagnostics, the ones which are innovative, but also can be accessible and deployed in the right conditions, those which are adapted to the different local environments.
Great, thank you very much.
I would like to comment.
Information, because we need to have also hope. We have at Institut Pasteur in Senegal now a unique producing also diagnostics for COVID. And I think that we need really to promote again local production.
Great, thank you very much. There's another gentleman over there, please.
Okay, thank you very much for the wonderful panel. My name is Amir Taki, and I'm Professor of Global Health Policy from Tehran, Iran. 3 questions, one specifically with Dr. Somia, and 2 general questions very quickly. The first one is, one of the main reasons, as the panel described, for this pandemic and the expansion of pandemic was vaccine inequity. And inequalities are widening after this pandemic, and other pandemics are very likely to happen. So my specific 2 questions are, given the distribution capacity will be around the world, to what extent we can ensure that when we need the vaccines and new technologies, there are enough fundings and intellectual property mechanisms in place that we can produce them at the right time and distribute them for the nations who cannot afford that. Because this vaccine nationalism and things will continue given the economic crisis. So how the panel can bring this, and one particular suggestion could be having some funding, a specific vertical funding mechanisms for this to be saved, like the funding for fight against tuberculosis and malaria and HIV/AIDS, that when it is needed, with a global mechanism, this can be dispersed and this can be used globally. These are 2 points that I just want to seek the panel. And my specific points for Dr. Somia, or perhaps other panelists, is to what extent, because some member states are following the new treaty, new IHR treaty, as you're aware of, to what extent you think that the IHR treaty would be needed to be absolutely revised and as a kind of new treaty to tackle the pandemics? Thank you.
Okay, great. Maybe we start with the first question, how to make sure that we can produce and distribute. Maybe I paraphrase a little bit. Do we need a new vertical fund? What do you think?
Well, let me respond on first on producing. We had in the 12 or 13 months where we developed a vaccine, we had to go to totally new massive manufacturing upscaling, which was a technical challenge. At the same time, we had the clinical challenge of getting the vaccine developed. And so it was the unpreparedness which was not enabling us to transfer technology as we had to do, but we still did it. We worked with Aspen in South Africa and with BioE in India in parallel, where we did it ourselves. And of course, then we come back to the previous discussion. We should not install manufacturing capacity while we are in the middle of a pandemic. We should have capacity long before that is happening and trained people, because we need to train people, transfer technology, upscale, work with quality. So it's all about preparedness and making sure that different platforms can be producing vaccines and over the entire world. So tech transfer and capability transfer is the most important thing to be enabling vaccine capacity in the world. And the same probably with diagnostic capacity. We are not in diagnostics and making the new medicines which are being developed at the moment for COVID. So it's anticipating and building capacity now for future pandemics and evolving with the technology. It's not just technologies which are now there, it's future technology also.
Right. Anyone else to add to this specific question?
I could come in on the global mechanisms for procurement and distribution. And this is exactly why we set up the ACT Accelerator and the COVAX mechanism in order to have an end-to-end process. So CEPI on the R&D side, funding a portfolio of more than a dozen vaccines, because we don't know how many of those will be successful. So you have to invest in multiple vaccines so that you get few. And then the Gavi facility, the COVAX facility for the procurement. And again, the concept here was to serve the world, not just the poor countries. So the mechanism was that those countries that could afford to buy the vaccines would buy them, the rest would be bought with donor funding. Now, I think it's a very good solution, and we need to do some analysis on why it was not successful, entirely successful in the time frame that we would have hoped it to have been, and how we can make it more successful in the future. It also needs, of course, the investments. You need a pot of finances that you can draw on immediately, because what happened was that countries that had the purchasing power blocked the vaccine supplies. They made the advance purchase orders, and companies will prioritize those orders that they've been prepaid. So COVAX was not sitting on a pot of funds that could immediately have gone into multiple companies and blocked doses. So that needs to certainly happen. And then finally, I think there are a whole host of recommendations. The International Panel on Pandemic Preparedness and Response, IPPR, and the IHR Review Committee and other committees, the Global Preparedness Monitoring Board, have all made very, very strong and sensible recommendations. And we've just tabulated them all with something like 220 odd recommendations, some for WHO, some for member states, some for the private sector. Every stakeholder needs to make changes in the way they operate. And I think a different model of R&D is also needed for pandemics, because it's a public good that you're developing, and therefore the investments has to be linked to the benefit sharing.
Right. Thank you. Anyone else on this first question before we turn to pandemic treaty, IHR review?
Maybe I wanted to add that the point you raised is for me the more important. We cannot wait for an epidemic to start to do things. Again, I am here because I want to speak more on Africa, and in Senegal, we were in 1,000 cases a day, etc. Now we have 0. People are celebrating. I say, no, we need to celebrate a little bit, but we need to ensure that we are now more focused. We are doing more. We have time to think, because if not, we will be surprised again and panicking when things will come. The other point is how to have financing. And this is also a point important. We in Africa, we need to have our own resource mobilization internally. We cannot afford to wait for abroad to come with money. We need to have also money for health, money for epidemic, money for pandemics. Now, the global community can also look at the mechanisms like we refer to COVAX, but COVAX also has not been, for me, funded as they expected. And it is why in countries you have sometimes a little bit coming and 1 month after another bit. And this is not good because the demand can be there and very fragile because of fake news. And when people want to go to vaccinations, they don't have, they come back and started to not be confident to the system. So I think that COVAX is a very good mechanism, but those who have created COVAX need to look again at the way they have been financing and supporting. Using also other mechanisms like the Global Fund, we have seen it for COVAX, for the COVID-19. They have taken the money they have to reaffect it for COVID-19 and looking at countries to ask what they need and what they want. So you can create also a specific fund. The question was what we will do. But all this need to be very well examined, because having a new fund again, people will say too many funds, and it is the same people who are giving money for the funds. Now, it is important to know, but something needs to be done, because we cannot wait for epidemic to come to do something and to fund. We need to have something in place.
Thank you very much. Would you like to also respond to the question on the need for a pandemic treaty vis-a-vis revisions to the international health regulations, or both? That was a question from the gentleman as well.
No, absolutely, there is a need. And this is, we're hoping member states, when they meet in November at the special session of the World Health Assembly, will seriously debate and discuss these issues. There are already working groups that are discussing different aspects, including R&D, including sustainable financing. So I'm hopeful that there's going to be some positive changes coming.
Thank you. We have another question here, over there.
Thank you. Good afternoon. My name is Casimiro Vizzini. I'm the Secretary General of the European University Alliance for Global Health. I think that what it was evident and emerged from this pandemic, it's the extremely poor science communication. This created an enormous issue in undermining, I would say, the credibility of the scientific community. So my question is, don't you think we need, in the 21st century, that is the century of communication, we need to fill the gap between communication and science through education? Don't you think that in terms of the United Nations system, we should promote a scientific reform for the education and science, mainstreaming communication for scientists and science for communicators, and eventually creating new figures, professional figures of science communicators? Thank you.
Thank you very much. Can I maybe ask Gitinji to come in if you like? Since you're not on stage, we always have to pull you in. What do you think about the need for a better, basically connection between communication and science? Oh, we can't hear you at the moment.
Yes, I have been having my hand on until it's tired now. So I'm glad that you called me in to comment. I hope you can hear me now. Yes.
Oh, you didn't hear? Did you hear my question?
No. Yes, I had it. I think we had a major challenge with science communication. And what we did originally was to gather journalists together, because at the end of the day, the platform for communicating to the general public is the media. That's the reliable and kind of trusted platform. Of course, social media played a big role, and therefore the competition between facts and fiction and disinformation and misinformation was a lot. And therefore we work closely with Twitter as well here in Africa to put certain keywords that people could actually get, when they were searching for information. But we trained health journalists or general journalists and editors on reporting on the pandemic. We actually even started a course on health journalism at Amref University to say, this is how you report a pandemic. We took them through the pandemic itself, the future, the past, and to give them, the questions they need to ask every time they're engaged. I think that was critical because journalists must be informed. The next thing is community health workers. That community health workers make a very key bridge to the communities because they're living with them day to day. And how do you train them so that they can actually convert science into day-to-day communication to their communities? We use technology, mobile phone technology specifically, to impart information to over 160,000 community health workers on what is COVID and ongoing science. And because these are platforms that are two-way, we could get questions from them, we could answer, and this was very useful in ensuring that the public got the right information from the scientific messaging to lay messaging through the community health workers who they trust. But of course, there are many other mechanisms, but I would just like to mention those two.
Thank you very much. Anyone else wants to jump in?
I would like to add that in the question on education, use of scientists, we have an initiative called the Forum, African Forum, Gallian Forum. It's a forum in Africa. For 4 years now, we are doing that every year. And WHO, the Director General, Dr. Tedros, is invited to this meeting. It is done in Dakar. We have almost 3,000 people online last year. And we are inviting the best students of medicines in Africa, in the different universities. And some of them are coming in Dakar and others are online. And we train them, not only an issue, the thematic this year will be global health security and some idea on that, but also leadership training, because what I say is leadership is very important. And they are trained, but we are also supporting a symposium for women and in science. Now, I want to say that the platform exists, maybe not very well known, and I will, after that, also do my best to, through this organization groups, to give more information on that. And my brothers and everybody's are very involved and invited to that. I just want to say that we have African platform and we need to use them for scientists. And other one is for fake news, another initiative where we are taking scientists. We are doing that with Speak Up Africa and NGO to push them to do more vocal and use media to be able to explain to people with some credibility, because they are scientists, for them to know what is the issue of vaccine or other things. But this is very important to involve scientists in what we are saying.
Great, thank you very much. I'm actually going to pick one question from the chat that basically talks to the topic we were just picking on. And it says from Jean Nishai, the panic that occurred when the lockdown was announced in some parts of Ghana was stupendous. I saw the same panic occur across the world. How can we break down preparedness to the individual level? How can we ensure the average person anywhere in the world is more prepared for the next pandemic? Do you have any thoughts on that?
If I may, I think it's a very interesting question because it brings us to the point of accountability, taking the question back to the individual level, that of the citizen, the patient, the voter, the fiscal contributor, is a way to basically ask the question of the accountability to policy makers, to the science community, and it's very important to keep that in mind. And well, on top of all the other topics that we've touched upon, I think there is one, and it does go back to that of education and fighting infodemics, etc., which is that of health democracy in some ways, and how indeed health is an issue which is indeed dependent on policymakers and the capacity of scientists, of the industry, etc. But this is also one which brings us back to the responsibility and the role of the individual. And since we've been mentioning the necessary local dimension, community health dimension, well, that really brings us back to not forgetting that this is about individuals eventually. So a very important
Want to add something
angle.
is most people, and especially young people, don't even know why their kids get 5, 10, 15 injections when they are born. All these diseases have been eliminated over years, and getting some education at school level where people are taught about these were pandemics one day, and all have been eliminated one by one because of vaccines. Yeah. Who knows what mumps are? Who knows what polio is? Who knows what? So all these diseases have been eliminated, and some history in the history lesson or in the science lesson to teach people, to teach students on why do we need give all these vaccines, so that you're familiar that pandemic is not a surprise. Although you had in your 30-year life on Earth, you didn't see it yet, but TB was eliminated, polio was eliminated. Why is that? So education, I think, is a very important factor to give people trust that this COVID is not a unique situation. It has been there over decades, over centuries, and threatened the world.
Great, thank you. I'm afraid we don't have any time left for questions. We're almost at time, but maybe you can ask after the session. I'm going to invite my panel now for a very short closing round. If you can please respond in one sentence. What is your hope for next year? Can I ask maybe Gitinji first?
Well, my hope is that we recognize that the future threats to peace and security in the world are not going to be war, which is the presumption when the UN General Security Council was formed. The future threats to peace and security for the world will be emerging and re-emerging diseases. And therefore, we need to restructure our peace and security assumptions around this, including climate change, so that we don't remain stuck in 1945 or 1946 when the UN Security Council was formed. Thank you.
Thank you very much. Dr. Swaminathan.
I hope that all countries will get serious about investing in health, in universal health coverage, because we always say universal health coverage and health security are two sides of the same coin. You can't have one without the other. And that governments and leaders will see it as an investment and not as an expenditure.
Thank you very much. Ambassador Saidu.
Well, I was going to say the same thing. I was going to say that I hope that at the World Health Summit next year, we'll be discussing the best formulas for investing sustainably in health as a new conversation, because that's what everyone will be really interested in.
Mr. Kosek.
COVID-19 has been a wake-up call for a lot of us. And we need now to implement the lesson learned, not to put it like this in our table, but to do things concretely. This is what I want, and this will help us to come next year or have other platform where we will say new things and not repeat again what we have said today. Thank you.
Thank you.
I hope in December 22 we'll have herd immunity in the world for COVID-19, as well as no mortality anymore. So can we reduce it to zero mortality and herd immunity? That would be a big goal and a big achievement, and we could have a world celebration on that one.
Great. Thank you very much. Thank you so much for this very interesting and lively discussion. I would like to thank my panelists. I would like to thank the audience. Please come back next year here in person. Stay healthy and goodbye.